Well, hi again, Mr. Bleeker here. This lecture will focus on male reproductive anatomy. We'll look at internal, external, we'll look at surgical procedures such as the vasectomy, and really examine how all the accessory organs of the male reproductive system work. So let's get to it. As far as external genitalia goes, the penis itself is sort of a dual function organ. If you look at the urethra, you'll see that if you follow this back, this blue line, this is plumbed all the way to the bladder. So the urethra itself is designed not only to deliver urine, but if we look a little more closely, what we'll notice is there is an additional set of plumbing here that can deliver what we call seminal fluid. Now, there's a few organs in the way here, but when we look at an animation such as this, here we go. I'll just replay this. What you can see here is the travel path for sperm to make it all the way from this structure here called the epididymis out past some of the supporting glands, which we'll talk about. And this is the point where sperm will enter the urethra and leave the body right here. So we'll come back to this. So the penis itself can be used, of course, to deliver urine. But if you look at the urethra, of course, it leads back to sort of a common junction between the bladder, and you can think of it as the reproductive system. Okay, now let's look at the reproductive side of this equation. Testes are located outside the body, and I'm going to tell you why. Testes themselves need to be slightly cooler than average human body temperature for sperm to be produced in not only adequate quantities, but to be produced anatomically correct. If sperm are generated and in an environment that's too warm, they won't be put together right, and they won't be effective at doing their job. As the testes produce sperm, they'll store that in these little adjacent sacs called epididymi or epididymis, singular. The epididymis is plumbed to what we call the vas deferens here, and that's basically a delivery tube for sperm to lead ultimately to the urethra. But the vas deferens makes a little turn. The vas deferens will pass by the seminal vesicles. Now, the seminal vesicles secrete an alkaline fluid and a sugary substance. When you deliver sperm to the female, the female internal environment is quite acidic, and the sperm themselves need to counteract that. So when they arrive in the acidic environment of a woman's body, what will have to happen is they'll need basically an alkaline sort of solution to that problem. So at this point, the seminal vesicles supply basically pack a lunch. There's some food for the sperm, and they give them a coating of an alkaline solution. Okay. Now, as this progresses, they get to the prostate gland. Now, the prostate gland in males has to be monitored fairly carefully because of concerns about cancer. And around the age of 40, about there, your doctor will begin to check it a little bit more. It is a walnut-sized gland. And what it does is it will produce the secretions that, as it says, gives your ejaculate is what they call it, seminal fluid. It's sort of a whitish appearance. So it's a supportive fluid for the sperm as they pass out the urethra at this point. Your bulbourethral gland it's an interesting term because the way more traditional term is Cowper's gland. It's a really kind of interesting but yet very important little accessory organ. I have to back up in this equation. This often will secrete ahead of the ejaculate which comes at this point. So once the vas deferens is sending its payload and you're getting to the seminal vesicles and to the prostate and you enter into the urethra, this is already secreted. And what it does is it secretes sort of a mucousy, slippery fluid. And what that does is that lubes the urethra so that when the seminal fluid passes out, it encounters much less friction. And that's just a reproductive strategy, hopefully to ensure that the seminal fluid is delivered in the most successful way possible. Now, there are some things, of course, that can go wrong with male reproduction. There can be blockages in the vas deferens. You can have tumors, other things of that nature. There can be problems with these accessory organs. It is possible for ejaculate, even at this point, to back up into the bladder so that the male actually isn't releasing the seminal fluid out of the body the way they should be. Okay, a little bit more anatomy to talk about here. So this is sort of more of a traditional diagram with pretty well everything shown. This is an important one to show because this is an uncircumcised penis. And in some cultures, this material here, foreskin, is removed. It's removed surgically. It's not considered to be something that has to be done. The thinking along removal of the foreskin here is that these folds produce too much surface area, that this could get infected. But with modern hygiene, that it really isn't such a problem. This interesting term here just refers to the opening that leads into the urethra, which leads up the penis. Now, the penis itself is it's an organ that's using sort of a hydrostatic pump, and that's the best way I can describe it to you. There are honeycombed cartilaginous caverns in here that are filled with blood during times of stimulation, and it's as the honeycombs fill with blood, it acts as a hydrostatic skeleton, and the penis itself becomes erect. After sexual activity, less nervous stimulation, these blood sinuses will close, and there is something called a refractory period, which is a period of time in which a male needs recovery before these cartilaginous caverns will open. So it just takes a little while. So coming back to this path, and I just want to replay that for you. You watch the path. Oops. You watch the path of the fluid as it leaves the body, like that. There you go. Now, if a male was to have a vasectomy, really what needs to be taken on is to just block that path, to make a cut here and to cauterize or seal this over so that the sperm cells can't get out of the epididymis. We'll view that now. So it's a long-term birth control method, to say the least. You cut and cauterize. They have to make a little incision in the scrotal sac to go in here to do this. But once this is cut or cauterized, there's no passage for the sperm to get out. In fact, the epididymis here will start to reabsorb the sperm, and there is no danger of bursting that goes on. The body will just simply reabsorb it, and that's the strategy. So the procedure itself is an outpatient procedure. It can be done in as little as 15 minutes. There's just a cut that has to be made into the scrotal sac. Basically, the cutting of the vas deferens is done. It's then cauterized or ligated, where they could tie the ends, but it's a little more common to cauterize it. And there's some swelling and mild analgesics like aspirin or acetaminophen, ibuprofen are more than adequate to deal with the problem. Quick outpatient procedure. Okay. And I think, yeah, no, that's it. That's really the end of the male reproductive series. Thanks for listening, and that's another one. Ciao.